Alright, so in this episode we're going to cover dobutamine and how it is used in the ICU. So quick disclaimer, the information provided in this video is for educational and informational purposes only. I'm not providing medical advice, diagnosis, or treatment. Although I am a healthcare professional, this content should not be used as a substitute for professional medical advice from your own healthcare provider. Alright, so what is dobutamine? Dobutamine is a synthetic catecholamine and beta adrenergic agonist. It is primarily used to treat heart failure and cardiogenic shock, and it does this by increasing cardiac output without significantly raising heart rate. So what is the mechanism of action of dobutamine? Dobutamine stimulates beta-1 adrenergic receptors in the heart, thus causing an increase in myocardial contractility, causing a positive inotropic effect. It also decreases afterload by mildly dilating blood vessels, and also has a minimal effect on beta-2 receptors and alpha receptors. So what are some indications and administration considerations when utilizing dobutamine? So some indications would be acute heart failure, cardiogenic shock, and low cardiac output following cardiac surgery. The administration for dobutamine, it's a standard dose of 2 to 20 microkilograms per kilogram per minute, and this is typically given via continuous IV infusion. You want to start at a low dose and titrate based on hemodynamic response. And you want to make sure to continue to adjust the infusion rate to avoid side effects like tachycardia and arrhythmias. So what are some monitoring parameters when utilizing dobutamine? Well, firstly, you want to monitor a patient's cardiac output. And this is due to dobutamine causing an increase in contractility and stroke volume. You also want to monitor a patient's blood pressure, and this is because dobutamine can cause hypotension due to its vasodilatory effects. You also want to monitor heart rate, and this is due to the risk of tachycardia or arrhythmias. You want to monitor for urine output as well, and this is because an improvement in urine output may indicate better perfusion. And lastly, you want to monitor for electrolytes, and this is due to shifts in electrolyte balance, particularly potassium, which may lead to hypokalemia. So what are some side effects and complications? Some side effects, like previously mentioned earlier, could be tachycardia, arrhythmias, hypotensions, especially in those patients that are already hypovolemic, as well as nausea and headache. Some complications you want to be on the lookout for is myocardial ischemia, especially in those patients with coronary artery disease due to their increase in oxygen demand. And like previously stated earlier, you want to monitor for hypokalemia. So what are some clinical considerations when utilizing dobutamine? Well, firstly, we want to start by assessing a baseline set of vitals and hemodynamics before initiating this therapy. We also want to have frequent monitoring of blood pressure, heart rate, and rhythm. We also want to make sure that we're titrating this medication based on the patient's response and thus minimizing risk of adverse effects. We also want to ensure continuous EKG and hemodynamic monitoring throughout. And lastly, we want to monitor for improvement in perfusion and cardiac output. And that is all. Thank you for watching, and please feel free to leave a comment with any future ICU medications or concepts you'd like to know about in the future.